Hi, I'm Dr. Nick Ninneman with Ninneman Chiropractic Clinic, and thanks for joining us in another week in our video blog series. This week's topic was again suggested to me by a patient. He emailed me asking me about stand-up desk. Stand-up desks are getting very popular in workplaces these days. As many people find out, sitting in a desk can create a lot of back and neck issues. So more and more people are starting to use stand-up desk because it can avoid the sitting position, and they find that a lot of times they feel better. But here's the thing that I want to focus on. If a stand-up desk is something you want to try, there's some things you need to take into account. First of all, like I've mentioned in a previous blog, is you need to have good shoes. If you're going to be standing while you work, you need to have good, comfortable shoes that are going to be supportive. Second of all, you want to have good flooring underneath you. If it is a hard floor that you stand on, you need to get some sort of padding, some thick padding that's going to provide some support for you. Because standing on a hard floor, and especially with bad shoes, it's going to put a lot of pressure and stress on your joints, and you're going to find out that you might actually have more pain if you do that. So again, wear good shoes and get some sort of padding to stand on. Another tip, if you're going to do a stand-up desk, is you want to make sure you're standing straight and not leaning to one side. One common thing that people do when they stand for a period of time is they tend to rock and put more weight on one leg. I even find myself doing this sometimes, and again, this can create more stress on one hip or one side of the lower back or pelvis. So again, make sure you're standing upright. Make sure you're not leaning on one leg or hip more than you are on the other, because that again will create more problems. One last thing to take into account, if you are a person that has what we call lumbar hyperlordosis, which in layman's terms is if you have a really big arch in your lower back, you'll notice that some people have a really huge arch when they stand, to where their pelvis rocks forward and they get that big arch. That makes you more prone to lower back pain when you're standing, because it's a biomechanical fact. When you're in the seated position, there's more stress put on the disc and more the front part of the spine. But when you're in a standing position, there's more weight bared upon the facet joints, which are towards the back part of the spine. So if you have an increased curve or arch in your lower back, you naturally have more stress put on your facet joints, which are the joints in the back part of the spine. And if you're going to be standing for a longer period of time, that's going to put even more stress on those joints in the back of the spine. So and you may know just from looking at yourself in the mirror that you have an increased arch, but if you're not sure, that is something that a chiropractor can evaluate. That's one of the things I always look at on a lateral view on a lower back x-rays. I assess the amount of curvature or arch in that lower back. So again, if you have a high or a big arch in your lower back, you may want to think twice about having a stand-up desk. So anyway, a lot of people wonder about stand-up desks. Hopefully this provides you some more insight on whether or not you should try it. But again, if you take all the proper precautions, have the proper curvature in your lower back, a stand-up desk could be a very good option for you to avoid the aches and pains and stress that comes along with sitting in a desk all day. Thanks for joining us again this week in our video blog. I've already had another great topic brought up by another patient about next week. Next week we're going to talk about swimming in pools and the benefits that it can have for your body. So thanks for joining us again this week. Have a great week and enjoy the weather.